Local anesthesia, Gow-Gates Block. The equipment needed for this procedure is as follows: personal protective equipment, syringe, 25-gauge long needle, gauze, anesthetic cartridge, topical antiseptic, optional, topical anesthetic, cotton tip applicator, and hemostat or cotton pliers. The Gow-Gates GG block is a true mandibular block because it anesthetizes almost the entire mandibular nerve. Thus, the nerves anesthetized with a GG block are the inferior alveolar, mental, incisive, lingual, mylohyoid, auriculotemporal, and long buccal nerves. The GG block is indicated for use in quadrant dentistry, in which the buccal soft tissue anesthesia from the most distal molar to the midline and anesthesia of both the pulp and the periodontium is necessary, and in some cases in which a conventional IA block is unsuccessful. One of the major advantages of the GG block is that its success rate is higher than that of an IA block. The target area for the GG block is the anterior-medial border of the neck of the mandibular condyle, just inferior to the insertion of the lateral pterygoid muscle. The injection site is located intraorally on the oral mucosa on the medial surface of the mandibular ramus, just distal to the height of the mesiolingual cusp of the maxillary second molar, and following an imaginary line extraorally from the ipsilateral intertragic notch of the ear, the lower border of the tragus, to the ipsilateral corner of the mouth. Load the local anesthetic syringe as demonstrated in the procedure loading the metallic or plastic cartridge type syringe. Before injection, follow all steps as demonstrated in the procedure, basic injection technique. Assume the correct operator positioning at 8 o'clock for a right-handed clinician or 4 o'clock for a left-handed clinician. Ask the supine patient to open his mouth comfortably wide. Use the index finger for intraoral retraction and the thumb for extraoral retraction on the dominant side and vice versa on the non-dominant side. Locate the extraoral landmarks, the intertragic notch at the lower border of the tragus and the corner of the mouth. Visualize the intraoral landmarks, the mesiolingual cusp of the maxillary second molar and the soft tissue just distal to the maxillary second molar. Dry the penetration site and prepare the alveolar mucosal tissue with topical anesthetic at the injection site for 2 minutes. Dry the tissue to remove any excess topical anesthetic. Using a 25-gauge long needle with the large window towards yourself, direct the syringe over the contralateral mandibular canine to premolar region so that the angulation of the syringe parallels an imaginary line connecting the ipsilateral corner of the mouth and the lower border of the tragus, the intertragic notch. Initially place the needle just inferior to the mesiolingual cusp of the maxillary second molar to determine the height for the injection. Next, place the needle distal to the maxillary second molar, maintaining the established height. Establish a fulcrum with the pinky finger of the dominant hand resting on the patient's chin. The height of insertion is superior to the mandibular occlusal plane, which is more superior than that of an IA block, approximately 10 to 25 millimeters depending on the patient's size. When a maxillary third molar is present, the site of injection is just distal to that tooth. Insert the needle parallel to the determined imaginary line until you gently contact bone with the neck of the condyle, approximately 3/4 the depth of the long needle. Aspirate within 3 planes to ensure that the bevel of the needle is not abutted against the interior of a blood vessel, providing a false aspiration. First, aspirate as usual at the depth of penetration. If aspiration is negative, rotate the syringe barrel gently towards yourself and reaspirate. If the second aspiration is negative, rotate the syringe barrel gently back to its original position and aspirate again. If aspiration is negative, slowly deposit 1.8 milliliters or 1 cartridge over 60 to 120 seconds. Carefully withdraw the syringe and immediately recap the needle using the one-handed scoop method with a needle sheath prop or other recapping device. Seat the patient upright immediately after the injection and instruct him to keep his mouth open for 2 minutes until indications of inferior alveolar nerve anesthesia are present. This anesthetic lasts longer than the IA block, so patients should be warned that they may be numb for several hours after their appointment. Wait approximately 5 minutes or more until anesthesia takes effect before beginning treatment. The two main disadvantages of the GG block are the numbness of the lower lip, as well as the temporal and buccal regions, and the longer time necessary for the anesthetic to take effect. Thus, this block may be contraindicated in a patient who may not be willing to undergo increased soft tissue anesthesia or wait time. This block is also contraindicated in patients with limited ability to open the mouth.